Across 50 states, 491 counties, and 650 clinics, Planned Parenthood provides comprehensive, quality care to 2.5 million women and men each year. This is a quote from Hal C. Lawrence and Deborah L. Ness, an OBGYN and president of National Partnership for Women and Families, published in the Annals of Internal Medicine on March 21st, 2017. If any of you are planning on starting a family, Planned Parenthood has many services that you may need. We, as a country, need to stand with and continue to fund Planned Parenthood. I'll be speaking on the problem of how Planned Parenthood is under fire but provides important services, and the solution of continuing to fund Planned Parenthood. First, I will be speaking on the problems facing Planned Parenthood. Planned Parenthood is under fire but provides important services for women. These problems exist because Planned Parenthood is surrounded by controversy and is facing budget cuts. It's currently facing defunding in multiple states. It has already faced budget cuts in Texas and is now facing it in multiple other states as well. This is because conservatives are taking aim at Planned Parenthood for providing abortions. This is according to Kate Zernick, a New York Times senior journalist, in a New York Times article published on March 15, 2017. This is a problem because of how many patients that Planned Parenthood sees. According to Laura Dixon, a research manager at the University of Texas at Austin, published in November of 2017, Planned Parenthood sees nearly 2.4 million patients a year. Another statistic by Richard L. Alliger and Pete Shenikin, the research director at Oregon Center of Nursing and a licensed attorney, published in the New England Journal of Medicine on March 3, 2016, says that around 15% of all rural areas would lose access to family planning services entirely if Planned Parenthood was defunded. If we defunded Planned Parenthood, we'd be stripping access from women to health care. In Texas, where they had budget cuts against Planned Parenthood, many women lost their access to contraceptives, and because of it, teen pregnancies rose. This is according to Laura Bassett, a senior Huffington Post reporter, in a Huffington Post article published on July 12, 2017. And half of all births nationwide are to Medicaid patients. And according to the Medicaid website, Jackie Garner, the Medicaid editor, last updated June of 2018, what Medicaid does is provide health coverage for low-income adults, children, pregnant women, elderly adults, and people with disabilities. And the babies being born are Medicaid patients themselves. According to the Budget Office estimates, if we defunded Planned Parenthood for even 1 year, it would result in $21 million increase in Medicaid spending in the first year alone, and an increase of $77 million by 2026. 1 in 5 counties that Planned Parenthood is in does not have a local federally qualified health clinic in it. Now that I've spoken about the problems facing Planned Parenthood, I'll now be speaking on the solution. We need to continue to fund Planned Parenthood. More specifically, we need to make sure money is not rerouted from Planned Parenthood. According to Laura Bassett, who I've cited before, we currently spend $500 million a year on Planned Parenthood. Conservatives want to replace this with $422 million to federally qualified health clinics. This push is because they want to defund Planned Parenthood. We need to maintain the current funding that Planned Parenthood has, and Congress needs to pass more laws to stop the defunding of Planned Parenthood. According to Laura Bassett, who I've cited before, when Texas cut funding to Planned Parenthood after a nationwide decrease of abortions, they faced a 3% increase in abortions. And according to Amanda J. Stevenson, an assistant sociology professor, posted in an article from the U.S. National History of Medicine on March 3, 2016, thousands of women lost access to long-acting birth control when they cut funding. And in the first 18 months alone, Medicaid births increased by 27%. A statistic I've cited before by Richard L. Alliger is that 15% of all rural communities would lose access to family planning care entirely if we cut this. Planned Parenthood provides many services, from STD screenings to contraceptives to pap smears for women. And Planned Parenthood is mainly for women, but not exclusively for women. And they see approximately 2.4 million patients a year, according to Laura Dixon, who I've cited before. Now that I've spoken on the problem of Planned Parenthood being under fire but providing important services to women, and the solution of continuing funding of this organization, we as a country need to stand with and continue to fund Planned Parenthood. Across 50 states, 491 counties, and 650 clinics, there's one organization that is providing quality health service to almost 2.5 million Americans. And that is why we need to continue to fund Planned Parenthood.